I'm Dr. Kelley McCullagh, and I'm a gynecologist in Katy, Texas, and I specialize in a very special non-invasive vaginal laser called FemiLift. FemiLift is a wonderful, non-invasive in-office procedure that is helping tons of women with a lot of symptoms that are very bothersome every day, like vaginal dryness, which results in painful intercourse, urinary leakage when they cough or sneeze, recurrent urinary tract infections, all the things that remind us that we're not young anymore. So I would like to introduce to you Theresa Buede, and she is a wonderful patient who has experienced the FemiLift treatment, and she is happy to talk to us about it today. Theresa, can you tell me about yourself?
Hi, first of all, I'm so happy to talk with you about this amazing experience I've had. Well, I am a cancer survivor, and one of the things that I'd like people to understand is I'm not just a survivor, I'm a thriver. So since my cancer treatment, which originally was in 1998, I went through many years of suffering, and that resulted in lots of setbacks, and that was really hard for me as a woman, as a mom, and as a wife, with many aspects of not just my health, but my quality of life.
What symptoms were you having that made you seek out a solution?
Well, actually, my husband and I, we've been married now 28 years, and he is a wonderful partner, helped me so much with my journey with cancer. But our intimacy had barely been affected. And you know, even though he loved me just as I was, I didn't feel good about me. I didn't feel as feminine, even I'd always been active. So for me, knowing in my own head that we could not have the same levels of intimacy because it started to get more and more painful. So I actually listened to Dr. Radio and they talked about this new procedure that was possible that somehow used laser therapy to help the surface of the vaginal canal be restored. And I'm like, wow, is that really possible? I started like, I wonder if that's even possible.
Right.
So I put my husband to work. He was highly motivated
to find a solution.
I said, I don't know what this is, but see what you can find out about it.
Right.
And that's how I started my journey now a little over a year ago. I guess about a year, a little over a year ago.
Great.
To find someone who actually could offer that.
So how did you find our practice?
Well, my husband had narrowed down options for me, and when I saw your practice and I read about you, I just felt an instant connection. I felt like this wasn't just a process and a procedure amongst many. It was something you had become very passionate about to actually make a difference in the quality of life, and that matters to me. I really wanted somebody who understood, you know, the whole feminine system, and you being a gynecologist, that's your area of extensive training, and that's huge to me. You know, I knew it wasn't just a cosmetic procedure, but it was going to be potentially life-changing. So with your professional background and your personal expression, it was just totally the ideal combination.
Right. I know there's some plastic surgeons that are actually doing the procedure, but
I wouldn't feel comfortable with that personally, because you know, everybody has to choose for themselves, but as a woman, and when you're talking about, you know, my most private area, my most feminine part of what makes me a woman, to have someone who really understands that. I also like the fact that you're a woman yourself,
right,
and you also have the gynecological expertise. You've delivered babies. You now are helping women to restore to that time, like now I'm experiencing, when I was in childbearing years.
Right.
That's pretty awesome.
It is. It's great. So just to reiterate, FemiLift is a 15-minute non-invasive in-office procedure that where we laser the vaginal tissue to help to restore it back to younger days. What the laser does is it triggers a healing reaction in the vaginal area that brings in more blood vessels and more collagen and makes each individual cell or the vaginal tissue restores it back to a more youthful state. Most women notice that it's a little bit uncomfortable, and we do give a little bit of numbing cream in it so that it's very tolerable, and there's no downtime. Did you have any downtime after the procedure, Theresa?
No, I was back at my office that same day. So
Great.
I just went and had some lunch and then went to my office. It was like wonderful. I was so excited.
Great. Thank you. I'm glad you found us.
I am
So
too.
what was your experience like in the office?
Oh, I just loved it. From the moment you walk in, you feel attended to. I felt like, the staff was caring and compassionate and sensitive to the fact that this is a difficult subject.
Right.
Because it is. It's a difficult
Right.
subject. It can be difficult to even admit that you have this problem.
Right.
And so nobody wants to talk about it.
Mm-hmm.
But I felt warm, welcomed, and, like, wow, maybe this could really work.
Great. So how would you describe the procedure? What was your experience actually while you were having the procedure done?
It was uncomfortable,
Mm-hmm.
but I was walked through it.
Mhm.
I knew what to expect, and you kept checking in with me, which was really good.
Mm-hmm.
I felt like if there was something that got a little more uncomfortable than what I was okay with,
Right.
you listened to me.
Mm-hmm.
So I felt listened to, I felt respected, and I felt encouraged with everything.
Great.
It was awesome.
Okay, that's what I try to do with everybody.
You're fantastic at it.
Well, thank you. How did your results? How would you describe your results?
Oh, life-changing, marriage-changing.
Marriage changing. That's great.
Yes, my husband is so happy. He's like we're newlyweds again, really,
Mhm.
because our kids are now grown,
Mm-hmm.
and we wanted to kind of rekindle our early years of being able to be together, and you really can't do that if you can't be intimate.
Right.
And so we are enjoying being able to be close in that way again.
Right.
And, it's great for both of us. He feels more of a husband, and I feel like a really good partner again. I feel feminine again, and that was lost. And I didn't want that to be lost.
And that's so important. It's part of our femininity. It's part of who we are. And if you lose that and can't get it back, that really affects your self-confidence, I think.
Yeah, and there isn't a pretty enough outfit to put on that changes
Right.
that, because you know what's going on underneath.
Right. Exactly.
Yeah.
Well, great. Well, it's very exciting to have a procedure that is making such a huge difference in women's lives. We don't want women to suffer in silence. We want women to know that this does not have to be their new normal. Thank you so much for Theresa for talking to us, and I know that your journey has been long, and I'm so glad it's making a huge difference in your life. Do you have any other words of wisdom for any other cancer survivors or women in general that can empower them?
Absolutely. One of the best things we can do is to find answers and definitely not suffer in silence. I just want to empower all women, just to think differently. What would you do if your daughter said, I just don't feel feminine anymore? Wouldn't you go to the ends of the world to find an answer for that person? Or if your sister, or even your best friend? When I looked in the mirror, and after I heard that program, and I'm like, you know what? I need to do for me what I would do for my own child. And that's what I did. I sought finding answers, and I'm so glad I did. So please, find answers. And this is not something to stay quiet about.
Thank you so much, and thanks for joining us.